Okay, so welcome to another episode of the BiohackerBlondie Podcast. I am so excited for this episode because we're here with Jin, and you are the founder of Jinfiniti, and we're going to get all into NAD. This is your second time on my podcast, and you are the expert in NAD, which everyone's so fascinated by. But I didn't realize you also have one of the most amazing longevity panels as well. So the first episode, we really got into NAD, and you have the supplements and then the testing kit, which is also amazing. So we have so much to get into, but then you also have your longevity panel, which I want to dive deep into because it's the most amazing. It's like 47 biomarker longevity panel, and I feel everyone needs to know about this. So thank you so much for coming on the podcast. Welcome. If you want to give a little intro, and I know we did on previously, but what is NAD? How did you get into this space? And then we'll get into it.
Sure. It's so nice to be back with you, Jenny. And I think you have done a wonderful job to educate the public about the importance of longevity, wellness, especially in biomarker testing and longevity protocols. I really appreciate the work you have done. I personally follow you and I enjoy what you have been posting, and we need more of you. And it has also been my pleasure to work with you over the last few years. So
Yes.
just very briefly to introduce myself to your new audience. I'm Professor Jin She. As I was telling you, I grew up in China. Then I went to college in China. And after my college, I went to France for my PhD degree in molecular and population genetics. Folks may not know what's molecular and population genetics. The bottom line is we program that combines biology and computer science or quantitative science. What it means is students coming out of the program not only knows about biology and medicine, but also have a very good foundation to data analysis. And we are very sensitive to data. We were taught to analyze the data, interpret the data, and also design experiment with a statistical mind. It's a very unique blend of experience and expertise. So I brought what I learned in my PhD program to the United States back in 1988. I
Wow.
was a postdoctoral fellow at the University of Florida for a couple of years, and then I guess I did a good job, and they kept me on the faculty. So I rose up from postdoc to assistant associate and full professor at the University of Florida Medical School, and I became an endowed professor. And what it means is they give me a bunch of money, so they trusted me. And they thought I was a good professor, I guess. So then I was recruited to the Medical College of Georgia in Augusta, and they built a whole research building to recruit me from the University of Florida to the Medical College of Georgia. I established the first PhD program that combines biology and computer science.
Oh, wow.
And it was the first program that was doing what's now called artificial intelligence or AI. All right.
Wow.
We started over 20 years ago. AI was not a terminology, or at least not a terminology spoken by everyone. And so we really focus on training students, faculty, and professors on both biological sciences and computer sciences. So they have full spectrum of expertise that they can get deeper into the biomedical questions to figure out how we can identify risk factors, how we can come up with preventive strategies for various diseases. So one of my largest research program lasted for over 20 years, and it costed over $500 million in the course of the study. It's
Wow.
the most intensive and most expensive and long-lasting research program that humanity has ever,
Paid for?
done. It was a lot of money. So, jokingly tell people that I wasted a lot of taxpayers' money when I was doing research. Not entirely wasted, but I felt that we made a lot of discoveries. We contributed to the knowledge, to the science, and but there was something that was really missing, in my opinion, and that
Mm,
was the ability to translate our discoveries and our knowledge into a service, a product that can really make people healthier and
mm,
live longer. That was really missing in academic setting, not just for me, but for almost the entire academic community. So
mm.
about 5 years ago, I decided to quit my academic job and ventured out to commercialization. And the goal was really to make something happen, not just contribute to the knowledge. We want to contribute to the health, to the
Mhm.
well-being of humanity. It was unbelievable transition because I used to have 80, 90 PhDs, MDs working under my supervision with a whole, research building. I had 5 secretaries working for me,
Wow.
and then I left everything behind. Me and my wife, and we basically came out of the university, had no money, no nothing, no, and started from ground zero, and to build
Wow.
the company that's called Jinfiniti Precision Medicine.
Wow.
And at the worst time point, we had $2,000 in our bank account. We had 2 young kids to feed. We have a mortgage.
Wow, this is so interesting.
We almost didn't make it, but fortunately, we were able to generate some revenue and keep us going. I'm happy to report that, now we're not a big company, but we are really providing cutting edge biomarker testing, cutting edge nutraceuticals, and more importantly, we have cutting edge. Uh, we have that can help a large number of individuals who have either some chronic conditions or who just want to become healthier and who
Mhm.
want to prevent future issues. It has
Yeah,
been a wonderful journey in the last 5 years. I wouldn't trade anything else for the decision that I have made.
it's
Yes, it's a long story.
I love that so much because I think so many people and most of the people in the space didn't come from, just wealth and they kind of just started the company from scratch. And I hear this a lot and it's very inspiring because I feel so many people think, oh, I need to have this huge bank account to start a company or to be successful. And it's like, no, when you have, the mission and, you're going to have the discipline and obviously you have the knowledge, it all comes together. You just have to keep pushing. And then you develop this amazing whole biomarker testing, which has helped me. Like when I did that, I mean, I know NAD is a big thing, which I'm such a fan of, and mitochondrial health and cellular health, but then also the panel, like I had low growth hormone. I had no idea,
Hmm.
or high, zombie senescent cells. And so it's like, I have to when you see these biomarkers, it's really cool to now I'm like, I need to take action and instead of guessing. And I've done so much testing this year. Like been in Berlin, I've done function, I've done all these like blood tests and urine and stool, but I've never seen a test like yours. Is there anything out there like your longevity panel?
The simple answer is no. That, that's related to my core belief and also my expertise. And everyone can go to LabCorp, Quest, and some of the other large um, medical testing companies. They can get hundreds and hundreds of medical tests or biomarkers tested.
Mhm.
And that's what I call it, the conventional or routine tests. They are more designed for diagnostic purposes.
Mhm.
When someone is sick and you want to do tests to find out what's the problem, what's the diagnosis, so you can take appropriate treatment treatment plan. right? So the entire so-called healthcare system that we should call sick care system is designed for diagnosis and treatment of symptoms.
Mm-hmm.
In my entire scientific career, the focus has always been about identification of risk factors and the prevention of diseases in the future, and a little bit about how we can improve the management of chronic conditions if they are present. So management of chronic conditions and the prevention actually have the same scientific basis. You want to know what are the root causes of the
Mm-hmm.
problems. Most often, clinical symptoms are not isolated.
Mm-hmm.
You may only know some of the symptoms because they are already at a very severe stage.
Mm-hmm.
And there are other issues that are already going on inside of the body that we don't feel, we don't see yet. But through biomarker testing, we can identify uh, the potential direction of the disease processes and see what we need to reverse it, what we need to prevent it.
Mm-hmm.
Fortunately, or unfortunately, depending on how you view it, I look at it as a fortunate event. Most of the age-related diseases, diabetes, heart disease, kidney disease, brain, I mean, you name it, they have a common set of root causes or risk factors. And very often I call it as the sub-health state, suboptimal health state,
Mm-hmm.
sub-health state. And there's a huge amount of overlap for all these conditions. So we ask the question whether we can identify this sub-health state, and that will tell us whether someone is at risk for multiple problems that can occur in the future.
Yeah.
And whether we can reduce these risk factors to prevent diseases or sometimes injuries from happening years, sometimes decades into the future.
Mm-hmm.
Fortunately, answer is yes. Yes, we can identify the common risk factors, and yes, we can come up with very simple solutions to reduce or eliminate these risk factors. And then consequently, when you take the risk factors away, we can give people many, many healthy years.
Yeah.
My personal goal is to be able to do what I want to do, which the number one thing that I like is tennis. I want to be
Mm.
able to play tennis at 100 and beyond. And
Yes.
I want to help as many people as possible to achieve similar goals. So basically what we want to do is we want to help people to extend their health span by 30 plus years. We know we can do it right now. It does not take billions of dollars, or it does not take 10 years or more. Some of the organizations are arguing and trying to get billions and billions of dollars to extend 10 years of health span in 10 years. I say no, we can do it right now. And we
Mm.
can extend by some 20 years with the knowledge, the tools, the methodologies that we currently have as a community. That's a very important message. And the key point is you want to be proactive and you want to be precise. You need to identify the issues that each person has.
Mm-hmm.
So you can prioritize the actions that each person has to take.
Yeah.
And if we stick to these principles, and we know we can achieve great outcomes for almost every single person. And it should not cost, millions of dollars. Some of the
Biohackers.
well-known individuals are either doing or proposing. You don't need to spend 100,000 or $2 million to become healthy and extend the health span. That
Yeah.
should be the core message, I believe.
I think so many people too are they're going to spend their money on supplements. They're going to spend their money on biohacking devices. Everyone's looking for something. And I feel like testing is the best investment you can make because when you start testing, you realize if there's deficiencies or if there's certain things going on or you have high HSCRP, inflammation or something, you can really dial down and figure out the root cause. So many people are like hesitant to testing. I mean, I'm sure you've heard of Function Health, and I've been promoting it since the beginning in 2023. And it's still difficult for people to test. And I'm like, they make it so easy. It's so cheap. And it really is the start of your health, like knowing what you need, knowing what you might need to detox, or your liver needs more, this, or, your hormones need more of this or something. So it's like stop guessing and test. And so that's why I'm such an advocate for people to be testing, but I've had to push people for sure. It's like people don't like to get their blood drawn. I don't know. It's like go to a place and it's a little difficult, but you have this amazing panel. You also have the NAD test for everyone who doesn't know. So everyone loves, NAD, and if no one understands, you can give like a little intro of NAD because that's also your specialty. And then I love how you have these tests, so you have your supplements too. And so instead of just saying, here's my supplements, it's like, here, you can retest and make sure progressing in the right direction. If you can give just a little intro of NAD, and then I want to get into the longevity panel, but you're the expert. And is there any other test out there that does NAD testing?
Right. So you made so many good points. I want to respond a little bit before I get into NAD specifically. You're absolutely right. The testing is so crucial. So if anyone who wants to understand the importance of testing, can DM you or me. We will send them a PDF copy of this book.
Oh, amazing.
And
Okay.
this what the tau of NAD, right? So in this book, I outlined the importance of testing as one of the 3 critical steps for anyone who wants to achieve better health and longer. Now, why tau? All right. Now, getting into the ancient philosophy, this is based on the Chinese ancient philosophy of called Taoism. Now, here, what's really important is it outlines the 3 steps: T for test, A for act, and O for optimization. As you indicated, testing is really the fundamental step. Why is it so important? We both, Jenny, you know, and I know a large number of people who take dozens, if not hundreds, of supplements. And how many of them know what supplements they need? And more importantly, what supplements actually work for them?
Yeah.
I would argue, and that's based on data, that 90% of the biohackers don't really know what they are taking are helping them or actually potentially harming them. And I have such large number of biohackers who have kidney suboptimal functions.
It's a good
It's a
point.
major problem. So chronic kidney disease has just become the number 10 killer in the United States. That was reported a
Wow.
few weeks ago. And
Wow.
even just a few days ago, new paper came out suggesting that kidney problem is a major contributing factor to Alzheimer's.
Wow.
It doubles the risk of developing Alzheimer's disease.
Wow.
Any biohackers, I'm not trying to
Hear you.
to scare you, but I am to get your kidney function monitored routinely, especially when you take hundreds or dozens of supplements that you don't really know the quality or the ingredients. And monitoring kidney function, liver function is absolutely key for safety and
Yeah.
also for efficacy as well. So testing really tells us where we are, what are the potential sub-health issues we need to deal with, and it tells us what actions we need to take, whether it's supplements. Supplements are part of the whole protocol, but supplements alone will not do anything. And you do stress the importance of lifestyle changes. That's the basic. That's the foundation. If you are not willing to change to a healthier lifestyle, no supplement is going to do the trick.
Mm-hmm.
So the basic step is to adopt a healthy lifestyle. I don't need to repeat it. Eat right, sleep well, get exercise, and all these things that everyone knows how to talk about. I'm not an expert on that, and I know a little bit, but it's important. It has to be done. And then supplements are absolutely essential. Some people don't like supplements. The reason is supplements are perceived to be useless.
Mm.
And I actually agree. Even though I have supplements, I do agree with that perception. The question is not whether supplements work or not. The real question is what supplements do work and for whom.
Mm-hmm.
And more importantly, what's the right dosing?
Mm-hmm.
You can have absolutely great product like our NAD supplement, okay? But if you take the wrong dosage, you're not going to get any benefit. If you take too much, it can be harmful.
Mm-hmm.
So dosing is the number one issue in the whole supplement or nutraceutical industry. It's also true to medicine, to drugs.
Mm-hmm.
For pharmaceuticals, it's less an issue because dosing is already taken into consideration by the doctors. Whether you take hormones or your hypertension medicine or your diabetes medicine or your endocrinologist, they constantly dose how much medicine and what medicine is going to help you.
Mm-hmm.
The same principle should be applied to wellness, to supplements, and to pretty much everything. It's all about precision. It's
Yeah.
all about personalization. It's all about monitoring the efficacy. It's all about monitoring the safety. There's nothing new in what I'm preaching. It's widely accepted in medicine, but it's lacking in the longevity / nutraceutical industry.
Yeah.
When I started, Jinfiniti 5 years ago, that's what we set out to do.
Mm-hmm.
We want to bring the vigor of science that was applied to pharmaceuticals and medicine into the wellness and the supplement industry so we can achieve the efficacy and the safety that are demanded from drugs
Yeah.
or medical treatment. And I'm pleased to see the progress that as a community we are making, but I'm not happy with how the speed that
Mm-hmm.
the industry is making progress.
Yeah, I think most people have the mindset I go to my doctor with my insurance, and then they tell me, my cholesterol's high or another issue, but whatever, if my cholesterol looks good, I don't have diabetes, I'm okay, you're good to go. And people need to realize that is the basic of they don't even really tell you maybe where your biomarkers stand. They're doing a very basic panel. And if you really want to feel your best, maybe look outside and go into more functional medicine and really get into your biomarkers because that few hundred extra dollars might give you 20 plus years, might extend your health span, your longevity, but also make you feel good today and prevent disease. So it's the best investment you can have. And people just think they go to their doctors and get a few blood tests and they're good to go. I'm like, no, you don't feel good. I
Yeah,
think most people in this world are inflamed and don't feel good. I
yeah,
mean, I've been there.
yeah. Yeah, I know you're absolutely right. The problem with I was part of the problem. I was a professor in medical school teaching making future doctors, right? And the problem in medical education, part of the problem is the doctors are too specialized, and at the end of their over a decade of training, they become very good at their own little area.
Mm-hmm.
When someone goes to see them, mm, you go see a specialist because that's the problem that they know how to deal with. But they don't think outside of their own specialty.
Mhm.
If you have a kidney problem, they're going to treat your kidney, but they don't know, well, the heart is problematic, or you may be increasing the risk for Alzheimer's. They are not trained to think globally.
Mhm.
So you get a partial view of the whole situation,
The
and
whole
you can
system of the
miss
body.
major problems that maybe they're already or are on the way. So that's
Mhm.
why the integrative, holistic approach by health professional is a very important addition to the care offered by specialists. I don't want to downplay the importance of specialists. If you really have a
Mhm.
very severe problem, the specialists are equipped to deal with those problems, and they are the
Yeah.
best to do, right? But if you want health, if you want preventive strategies, those specialists they are not the right ones. You need both, and when you are really very sick, go seek the care of a specialist. But when for your routine care or preventive strategies, you want someone who is more holistic, who is taking a global view and taking global actions. That's how you can get a much better outcome.
Yeah, I think like insurance companies too, they govern doctors and pharmaceutical companies too. It's like doctors probably feel this pressure of how much they can test, how much they can do prevention because I feel like our medical system is so focused on reactive care instead of prevention. And it seems like if you want to do prevention. Like vitamin D has now been a normal thing, but I used to have to like beg my doctor to test me for vitamin D, and I think the whole system is just not meant for prevention and it would cost us less as an economy if we did prevention, but for some reason instead we're paying for all this reactive care and it's costing us a lot of money. So it's a little doesn't really make sense, but here we are trying to make a difference. And that's what you're doing with your testing
Yeah,
and your
right.
supplements and everything. So how do we how does this NAD test work? I mean, your biomarker testing, like who comes up with this? How do you just come up with an NAD test? I know NAD is not easy to test, and I want to hear how you
Yeah,
dove down into all these amazing
yeah.
biomarkers.
So about 5 years ago, when we left academia, and we wanted to focus on longevity, and so we studied the field and were trying to figure out what role or roles we can play, because we as a scientist, I don't want to do something that other people are doing very well. That's no if there's a good solution for a problem, I'm not smart enough to outcompete them, and I don't want to. So we wanted to identify areas that were in heavy demand and no one had a solution, and but it's an important problem to solve. So, and also we know our expertise were in biomarker development, identifying new biomarkers, implementing testing in clinical settings, and that was one of our core expertise. So when we look at the field and we realize, we look at the hundreds and hundreds of potential biomarkers, both the ones that were testing, and more importantly, what new biomarkers may be important to the longevity community, but tests were not available. So we had the first 4 or 5 biomarkers that we zeroed in, including NAD, was at the very top. So you know, people have tried to come up with an NAD test for decades, and no one was able to develop a clinical grade NAD test. For research laboratories, they couldn't do it because it's very different than clinical testing. So that was the first one. The second one was the senescence, or zombie cells, and that was another very big one. And the third
Mm.
one is oxidative stress,
Mm.
and then inflammation, and a lot of people are testing CRP. A lot of people know about CRP, very important, but CRP is really only the very beginning. There are thousands of inflammatory biomarkers that we can test, and then later on, the fifth one that became very important was a longevity hormone called Klotho, Klotho. So these were the top 5 biomarkers that were very important, and were no good solutions on the market. And we said, well, we know how to do biomarkers. So we started working on the problem, and I think, well, both my wife and I, and we have a couple other trainees, postdocs, students, and we have a very comprehensive set of skills that are very difficult to find in any team. So we decided to work on the problem, and we were able to come up with a NAD assay. And relatively quickly, it still took quite a bit of time. It turns out that we had a very simple assay. You can do a finger prick, get a drop of blood on a special paper, and let's use it for the newborn screening programs. And so then we can extract the NAD out, and we developed an assay that can be automated, and we developed a NAD stabilizing buffer and a stabilizer, which was one of the key issues because the NAD molecule is not very stable. You have to figure out a way to stabilize it so you can transport the samples from remote locations to the central laboratory. There were a number of small problems that we had to solve, but if you don't solve all the little problems, you don't have an assay. That's the tricky part. That's why no one was able to come up with an assay until we did. And then for about 5 years, and there was no one who can come up with a really reliable assay. Even now, we have a couple of competitors. I'm not going to badmouth about anyone because it's not my nature. But I think people still trust us the most, not only because we have a great assay and reliable assay, but more importantly, we have the knowledge base about NAD and how we can get people the functional and clinical benefits.
Yeah.
And we have done, over 100,000 tests so far.
Wow.
And we have before and after treatment data on, tens of thousands of people. So we really know at what level people are supposed to get the functional or clinical benefits or preventive benefits. You cannot just increase NAD a little bit and hope to get the benefits. You really have to elevate the levels high enough to maximize the benefits. But you cannot go too high. If you go too high, then it becomes problematic as well. And when it doesn't work, we have multiple supplements, and we can change the dosing, we can change the supplement types. And our promise to everyone who trusts us is no matter what, we are going to find a solution for you. We have a supplement that works for 95% of the population with the testing dosage adjustment. For the few percent that this product doesn't work, we have other products, and I actually personally spend my own money to give them the other products and give them free NAD tests to find a solution for them.
Wow.
My promise to everyone is, if you come to work with us, we're going to find you a solution. And after the initial testing and the trial, we don't want you to pay for it. We will pay for it.
Well, yeah. So can you just tell the audience why NAD is so crucial? And I also am curious, is the only way to increase NAD just with supplementation, or are there other lifestyle factors or foods that will increase NAD?
Right. Very good question. NAD is so crucial because it's what we call the core enzyme. It's a core factor, if you want. This core factor is involved in the function of over 500 different enzymes in our cells. Okay, if any of these functions doesn't work properly, you have some health issues. Let's just take the number one function. The number one function of NAD is to help the mitochondria to produce energy. The cellular energy is in the form of ATP. Some people may have heard of it, right? So our cells are constantly producing ATP in the cellular power plants called mitochondria. Hundreds and thousands of little power plants inside of our cells, each cell.
Yeah.
They constantly pump out ATP, all right? Without ATP, the cells wouldn't work, just like your car wouldn't run without gasoline. Same principle. And without energy, there's no life. We're dead.
Yeah.
Just by this one function, you know how important NAD is. All right. And then I can sit here, we can talk for hours about all the other functions. Inflammation, brain function, senescent, and
Energy for every part of your body.
Every part of the cellular function and requires NAD. So, and that's why NAD is so important on a molecular basis. But the unfortunate part is that as we age or as we have health issues, NAD levels decline. It declines with age. It declines in individuals even when they are very young, if they have health issues. One example I can give the audience is not very young children, 2 years old, 3 years old. If they have autism, NAD levels is at the bottom. And it could be even lower than a 50-year-old.
Wow.
So health issues, the inflammation can dramatically reduce NAD levels irrespective of age. And in adults, even if you are very healthy, you don't have any apparent clinical symptoms, NAD levels also drop. So these are the two major reasons. And so that's the unfortunate part. That's why we needed to get our NAD levels increase, or I prefer to say optimize. They are potentially many different ways that we can use to increase NAD levels. I know you probably want to know what's the lifestyle changes that can increase NAD levels, because some people may not want to take supplements. I would love to find a solution as well. The answer is yes, but it's probably not enough. There are certain activities that can naturally increase NAD levels, and exercise is known to increase the enzyme that helps us to make NAD, but the boost is probably 5 to 10%. We are deficient by over 100%. So yeah, you are making some improvement, but it's not good enough. Sauna can probably increase NAD a little bit. I mean, there's some data out there. Again, it does not do the job completely. Certain foods, especially if they are enriched for some of the NAD precursors, like tryptophan. Tryptophan can be converted into NAD, but it takes many enzymatic steps. It can do the job, but it's not very efficient. Again, it's very hard to get NAD levels optimized. Niacin, or nicotinic acid. Niacin is actually fortified into the foods in America in the 1970s. And I believe this is partly responsible for the higher levels of NAD that we see in the American population relatively to some Asian countries, especially Malaysia and Korea, India, Vietnam, and also China. So the average level that we see in America, especially American Caucasians, almost doubles what we see in the Malaysian population, for example.
Wow, interesting.
That's a genetic contribution, but I think there is also a lifestyle food supply contribution to it. The bottom line, yes, you can adopt a certain lifestyle and get your NAD levels relatively better than not doing it. But I want everyone to understand very clearly. And just by lifestyle or food choices, it's extremely difficult to optimize your NAD levels so you can get the full benefit from optimized NAD. I have tested so many people. There's only one individual who claims that he does not take any NAD supplements, but his NAD level is optimized. I don't know why. That's the only person. Okay, maybe he's taking something that's high NAD precursor, maybe most likely niacin, that he does not know.
Mm.
So niacin is actually a very good NAD precursor, but niacin has many other issues. It can actually speed up epigenetic aging, and it will have some limited data on that. So you can increase NAD, but it's probably not a good NAD precursor. The best way of increasing optimized NAD is through NAD precursors, especially NMN or
Mhm.
NR.
Mhm.
I personally like NMN better than NR, but NR can work. The difference is not really between NR and NMN. The biggest difference we have seen is between the pure NMN or NR and well-formulated formula that can give synergistic effect.
Mm.
That's the formulation that we have. It's a patented formulation that really gives synergy from multiple ingredients that we have. With that formula, we can optimize NAD for 95% of population. With pure NMN or NR, usually it only works for about 40% of the population.
Wow. Would you say that most people who have low NAD, since you have so many tests, I mean, is definitely a symptom low energy? I think a lot of people have low energy, including myself before I got into NAD and everything. My energy that I normalized was so low.
Mhm.
So is that something people say once they increase the NAD levels, they're saying, wow, I have so much more energy?
If we can get their NAD levels to 55 to 80 micromolar, and about 90% of the individuals or users will see increased energy levels and maybe better sleep and so on. Now, I
Yeah.
must say that NAD deficiency is a major contributing factor to lack of energy or fatigue, but optimizing NAD is not going to solve the problem for some individuals
Yeah.
because multiple
Factors.
problems can contribute to the lack of energy.
Yeah.
Hormones, right? Es-
Yeah.
Yeah, especially women during peri or post menopause.
Mm.
You have to think about hormone levels, estrogen, progesterone, and sometimes to a lesser degree testosterone. You got to get
Mhm.
these hormones optimized.
Men too,
And
their testosterone.
thyroid issues.
Yeah.
40% of American women after age 40 have Hashimoto's, which is hypothyroidism. Yeah, 40%.
Wow.
That's
Wow.
one of the problems I studied in my 40-decade academic career.
That is so crazy.
Hashimoto is hypothyroidism, and the hyperthyroidism called Graves' disease is much more common in China than in America. And in America, it's more Hashimoto's than
Wow.
Graves. And in China, it's the opposite.
Do you think it's diet or genetics?
It's both genetic and diet. Iodine intake, I mean, it's a major contributing factor, but that's the issue now in the industrialized countries. It's a autoimmune issue. That's why the incidence goes up as people age.
Mhm.
So, so thyroid hormone is something that people need to check. If NAD cannot give you the energy back, right?
Yeah.
Definitely thyroid hormone, thyroid health, very important. Adrenal hormones,
Mhm.
and a lot of the hormones are regulated by adrenal hormones, right? Magnesium,
Yeah.
simple magnesium deficiency,
I
that can be
know.
part of it.
I mean, any of these deficiencies, like I was
Yeah,
deficient in iodine, and
I,
I knew this before. I mean, 2 years ago I was deficient, helped everything, my hair and everything, and then I forgot about it because I
yeah.
tested good levels, forgot about it, and then I retested this year, I'm low in iodine again. So I'm like, and that one factor can really change your energy and your immunity and everything.
That's why we talk about a holistic approach, right? That's why the panels, at least once a year, you want to do the panels. And another thing we find is iron deficiency, anemia.
So common.
40% of the people we test are low in ferritin. That indicates iron deficiency or bleeding.
I'm low. I was low. I'm getting low in that
You are
too.
low. Well, we need to get a
And that's why I think people need to understand that I do these tests, but then your levels fluctuate. Your diet changes, your lifestyle changes. And so I've been iron deficient, extremely iron deficient, and I really worked hard to get my levels up. You kind of get a little relaxed and then you forget about it. And
Why?
then
That's the one word that I offer to everyone, right? The last I have 8 P words, right? Words that start with a P. The last one is persistence. And
there's
that's the
so many things you just almost forget, it's you're trying to figure everything out and then you're like, "Oh yeah, quercetin, that's a good one for
yeah.
my immunity." But there are quite a few things.
Yeah, me actually, I'm pretty good. So I take unless I'm traveling outside, it becomes a little harder. But if I'm at home, and most of the time when I'm outside, I take my daily regimen without fail. I mean, this is just part of my routine for my whole family, even my young kids, 5 and 10 year old. They have
Yeah.
their own regimen and so a daily activity.
I don't wanna get too high on some things too, like iodine, I started to go at the very high end, so that's why I stopped. Or certain supplements, B vitamins right now,
Yeah, I know. Your B vitamins are a little too high now.
that's because every supplement now has this, like, 10,000
Oh,
of vitamin B12, and I'm like, I can't now because and everyone's giving B12 shots thinking
right.
it
The advice is that's why our philosophy solve this problem. So we
yeah,
create a series of supplements that are very precisely dosed that you can adjust. Okay, so people tend to want to buy different supplements from different companies, and most companies don't care, just make individual supplements and that
and
they
I
have
know.
ingredients everywhere. We make supplements that are so well formulated that don't they don't overlap in dosage. If you take the 15, 20 supplements we make, everything is properly dosed. So you don't
Yeah,
overdose on anything. If you needed to adjust some ingredients, you just adjust that particular one.
yeah,
So when we
that'll fix
designed
your
our
kidneys.
supplement system, we consider all these issues that you are talking about.
Yeah, I mean, it's a learning curve and I'm learning and testing is the best thing you can do because then you figure out, maybe I'm doing too much of this, not too much of this. I need to change my diet. Maybe I need to eat more seaweed. Maybe I need to eat a little bit more meat or,
Yeah.
everything is changing throughout the year. So it's always good to keep retesting. I did want to get into these amazing biomarkers. I know we're like time's flying by. But I definitely have to talk about growth hormone. We
Yeah.
have to talk about Klotho. A lot
Yeah.
of people don't know about these, the senescent cells. Like HSCRP, I think most people know it's a very beginning biomarker for inflammation. And I also wanted to get in the cytokine. I don't think a lot of people know to test for the IL-6, IL-8. So just if you can give a breakdown of we'll talk about the 5. There's 47 biomarkers,
Yeah.
like full longevity biomarkers in your longevity panel. But if you wanna talk about maybe the first 5 that are you felt the most important and, why they're important and why we should test.
Okay. So the number one that people should test is NAD. We already talked about it. Second one, we'll take it easy, vitamin D. Let's take the easy ones, right? So NAD, people may want to come to us to test for NAD. Vitamin D, you can get a test from anywhere. It's not a problem. But getting these two optimized. And the next one that I really want to emphasize is both sex hormone and growth hormone, or put them
Mm,
into one category, all right? And so that especially for women, but also for men. Post-menopause, almost every single woman is deficient in estrogen.
mm.
and very few of them are actually taking any actions. We don't have time to get into the reasons, the details, but for whatever reason, women are not recommended or made aware of the existing treatment options. It's called hormone replacement therapy.
Mm.
And I think less than 5% of the, even in America, less than 5% women are doing HRT.
Well,
Good for them. But
more
what about
popular
the,
for
yeah,
men,
yeah,
I
more
think.
popular
Okay.
for men. That's why I don't want to talk about the men.
I feel like testosterone,
Yeah,
everyone.
even testosterone, but still it's only for a very small population. The large population is not. Even I was not worrying about it. I
It's
knew my testosterone was very, very low. Even by the medical standard that they had.
mm,
For 95% of women, they have not heard of HRT. What I
wow.
want to stress even more is we are getting more data now. I don't have enough data to give you a percentage, but a lot of the women who are on HRT don't have their estrogen optimized.
Wow.
And if their estrogen is reasonable, the other hormones may not be totally optimized either. Okay,
Mm,
I can test 3 hormones easily to say how well they are managing their menopause or post-menopause.
mm,
It's a major, major problem, and we have a very simple solution. Herbal formulation
mm,
that can optimize estrogen, that can optimize some of the other hormones like progesterone and
mm.
FSH and LH, female-related hormones. And I believe a natural solution will encourage more women to take actions. This is going to fundamentally improve women's health in all aspects.
Yeah, I think hormones, I mean, 20s, 30s, I'm just seeing low testosterone hormones out of like from so many people. And I don't know if it's, I definitely think the food and lifestyle factors, sleep is a huge issue for hormones. And so it's like all of this coming into play. Can you talk about growth hormone?
Yeah,
Because
good.
that's a really cool one for me.
Growth hormone is almost non-existent in about 90% of the population.
Non existent?
Yeah, we cannot detect it in 90% of the
Okay, I
people.
feel better because mine was low.
Yours is not bad. Yours is not bad. No, you are probably at the 99th percentile.
Wow. Well, I'm
Maybe
taking a
maybe not,
peptide for
maybe
growth hormone now.
99.9 percentile.
Wow, that is insane. It's so
But
important.
my growth hormone level was 0.02. My wife
Wow.
was 0.02.
It's now 0.02?
No. Previously.
Okay.
Now,
And what did you do?
we have some solutions, and we're still working on the solution. We have a supplement. Mine increased by over 20-fold. My wife is increased by over 50 fold.
Wow.
And now we still don't have a perfect solution. It's getting to a much better level, but we're still working on training, supplementation, and lifestyle protocols. This is going to take a whole protocol, not a single supplement is going to do it. All right.
Yeah.
You really have to work on multiple fronts, training, especially high intensity training, and we are working on the red light therapy to see whether it can improve
Mm,
lifestyle, sleep, exercise you mentioned, and supplementation.
yeah.
So we don't have a perfect solution. Is a peptide that's supposed to increase growth hormone. I don't have any experience with that, but we're going to look into it. I don't really want to get into peptides because it's not totally legal.
We don't have to, but that's what I'm doing to hopefully increase my growth hormone.
Yeah. So hopefully the situation will change. And on an individual basis, I can do it, but I cannot really recommend it
Yeah, the audience.
to the audience. Is fine because I'm not
Not
uh,
medical advice.
yeah, not providing medical even medical advice. I mean, it's fine, but I'm not selling anything. That's the point.
Yeah. So let's talk about senescent cells as well. I thought this was so cool because everyone talks about senescent cells, but is anyone really testing? So I think that's really, and that was an eye opener for me because now
Yeah,
I need to take action. When you have
yeah,
high senescent cells, it's very damaging.
yeah. So senescence is what we found is senescence levels are much higher in individuals with various health conditions, including cancer.
Mm.
And also we know senescence has a major impact on how patients respond to therapy. We did a
Mm.
study with over 2,000 cervical cancer patients. What we found is um, the survival of cervical cancer patients with lower senescence level is much longer. It's 4 or 5 years longer than
Well,
patients with lower senescence level. So that's a huge survival difference when you have a better survival when you have lower senescence versus a higher senescence. So
wow.
senescence, there are many potential harms and senescence cells can cause, but the number one issue with the senescence is the secretion of inflammatory cytokines.
Mm.
Everyone talks about the inflammation. Many people understand why inflammation is bad. Chronic inflammation is definitely a major risk factor for diseases. But very few people understand that chronic inflammation comes primarily from two sources. One is senescent cells. Second is oxidative stress, free
Mm.
radicals. Okay. And many people are talking about using anti-inflammatory supplements or foods to reduce inflammation, and sometimes it can work. It's important, but you really have to reduce senescence and oxidative stress if you want to have a control over chronic inflammation.
And what things would you suggest to get rid of senescent cells and reduce the oxidative stress
Yes.
for
So,
me?
yeah, for you and for everyone else, I would recommend a mild approach initially. And what we use is a combination of several flavonoids and quercetin, fisetin,
Mm, which I'm
and
taking of Jinfiniti.
yeah, we have a product called
Good.
it has a lot of different properties, uh,
Mm,
but and also combined with a good dose of vitamin C. Vitamin
mm,
C can synergize with quercetin for fighting against senescence. So
mm.
that's a mild protocol. It takes some time, and then we'll see how this works. Works for many people, and we may or may not need to get into some other more aggressive treatment, which I don't really like.
Like what?
Some people are taking rapamycin, and
Mm,
I I don't like rapamycin. I don't
uh,
recommend rapamycin.
yeah,
If someone wants to take in rapamycin, my recommendation is get tested, get a full comprehensive panel, know where you are before you take it, and know where you will be after you take it. And
yeah,
otherwise, you can have some unexpected consequences.
yeah,
Very important to test. I'm not going to tell people to not do it if they want to, but get testing, know what you are doing. That's very important. And they are there's a new formulation that we're making that could be a little more potent than the quercetin and fisetin. That
mm.
take the signal aid for 3 months, retest and see whether you are trending in the right direction, and
Okay.
we'll go from there.
I'm hoping.
For the oxidative stress, and we test many. The way to do it is you want to have a high levels of antioxidants. Your antioxidant level is actually quite good.
Mm,
We may want to try a different antioxidant, and have a new
Interesting.
one that's even not on the market. I'm only making it available to some friends and some people who work very closely with us, and they are
Okay.
beta testers. And
I'll be the guinea pig.
if you want to be a guinea pig, I'll be happy to give you some. It's pretty unbelievable. It's called a rejuvenate. And
Wow.
yeah,
Okay.
we
Okay.
we really like this product. So
Oh, wow.
I'll be happy to send you some, and we'll see that. And also, have you tested your heavy metals, microplastics?
I haven't. I've had mold toxicity twice before, and I think that was very damaging to my system. And I think I've been doing a lot of sauna and detoxing that now again.
Yeah.
But my heavy metals are good. I haven't tested plastics.
Okay. So the toxins can be a contributor to the oxidative stress.
Yeah.
90% of Americans have high oxidative stress. It's very hard to manage.
Yeah.
They are n- different people require different solutions. And there are solutions to get it done because European Caucasians, only about 10 to 15% of them have high oxidative stress.
Wow.
Americans, 90% of Americans have high stress. And also, some people think that they are doing a plant-based diet. A lot of the plant-based, or people on plant-based diet, a strict plant-based diet, actually have very high oxidative stress. How do I know that?
Interesting.
A lot of Indians. I mean, I hope this is fine for me to say it. I'm not trying to stereotype or anything. I'm just stating the fact for people to know. A lot of the Indians have very high levels of oxidative stress.
So interesting.
Theoretically, they are plant-based. Most of them are plant-based. They should be good, right?
Yeah.
But they have high oxidative stress, high levels of diabetes, and extremely deficiency in micronutrients, including vitamin D. Many of them are in single digit.
Wow. That is scary.
So, you know, what I'm going to say may be controversial. If you are a plant-based, if you use a plant-based diet, get your micronutrients tested. You are
Yeah.
highly likely to be deficient in
Yeah.
micronutrients, various micronutrients.
Yeah. I
Uh,
agree. It's
unless
not easy.
unless you are supplementing correctly. And there
Yeah.
are solutions. Okay, I'm not against a plant-based diet or anything. I'm not against anything.
Yeah.
It's just you want to know. You have to know what's good, what might be good, but everything has a consequence. Yeah, everything can be good, but there may be a consequence that you don't want, right?
Yeah. And you could be eating too much sugar, too many carbs, or too much processed food.
That's another problem. So the high oxidative stress in plant-based diet is actually because of high sugar or carbohydrate content.
Mm,
That's the primary source of oxidative stress.
yeah. Yeah, I think people need to realize, like, keeping your glucose levels stable is very important to basically not burn out your cells.
Yeah. Yeah, glucose is very important, no doubt about it. You're absolutely right. Oxidative stress is something that comes from high carbohydrates that people
Uh,
don't link together and don't pay attention to.
yeah.
Your blood sugar may be okay now, but if you are causing high oxidative stress, then you are going to cause high inflammation. That's definitely not good.
Yeah. So I know we're going way over time, but I did want to touch on Klotho because
Yeah,
this is a new thing coming out.
yeah,
And it's a little bit of gene therapy coming out. They have now these peptide Klotho injections that are coming out as well. So what is Klotho and why is it so important and why did you include this in your test?
yeah. So Klotho is a protein, and that's primarily secreted by the kidney and a little bit by the brain. And
Mm,
function, it has a variety of function. It's a cell surface protein that can serve as a receptor, and it also has a soluble form in the plasma that acts as a hormone.
mm,
All right, so it plays very important roles in various organs, especially kidney, the brain and the heart and various organs. It also plays a very important function in regulating inflammation.
Wow.
So, and it's also very important for aging because its function is so important to longevity. So the protein is named after the Greek goddess that
Mm,
determines how many years you have to live.
I didn't know that.
Yeah, that's where the name comes from. Go Google Klotho, the Greek goddess called Klotho, right? And she has two sisters. One sister can prolong your longevity, another one can take years away from you. But
Mm,
also is the one who gives you the number of years to start. That shows
interesting. I
how
didn't
important
know.
it is. Now,
Yeah.
so what we know is cortisol level is highly deficient in a number of health conditions, especially chronic kidney disease. 70% of the patients with chronic kidney diseases is severely deficient in cortisol, and about 70% of cancer patients, various types of cancer patients, is extremely deficient in cortisol. But in some
Wow.
cancer patients, strangely enough, I don't understand why yet. I have some theory, and they can be extremely high in cortisol as well. So that's
Interesting.
a very sweet spot for Klotho, just like for NAD. You don't want it to be too low. You don't want it to be too high.
Interesting. That's good to know.
Individuals with COVID and or maybe some other infections as well, their Klotho levels can drop precipitously. That happened to me several times.
You tested Klotho before and after?
Yeah. So Klotho
Wow.
is actually a very good biomarker that reflects how your body is actually doing.
Wow.
In that sense, it has something a similarity to CRP. You know, CRP changes based on your
Yeah,
health.
your
If
inflammation.
if you have an infection or you have some pathological problems or surgery, your CRP levels will go through the roof. Here is the opposite. When you have health issues, cortisol goes down. When you
Um,
improve the general health condition, it goes up.
Interesting. Wow. This is such a new topic that people
Yeah,
are like, "What is Klotho?" And
yeah.
now we're looking at it as a longevity biomarker.
Many people that believe that cortisol can be a very good therapeutic agent. I believe so as well, but there's no data out there yet.
Yeah, that's good to know.
Okay,
That's
so
a very forefront.
I'm just trying to tell people that, don't. Yeah, it's a great biomarker. Can we use it as a therapy or treatment to improve health conditions or increase longevity? We don't know yet. No one
Mm,
has any data that
mm,
we're aware of.
okay. This
You
is
know,
good.
most people come to me for testing, but I have not seen uh, mm,
Before and
data
after.
that that can we are going to be able to treat certain conditions. It's
Mm,
impossible. It's very likely because I know when the health condition improves, cortisol level goes up. So that's very good evidence. But no one has been able to show, oh, I increase your cortisol, you are going to do better. That
yeah.
evidence is not there yet.
That's a good point. Can we also just touch a little bit on the TNF? It's also a biomarker, which I thought is really cool in your
Yeah, so TNF is called a tumor necrosis factor, and the one that we're testing is alpha form, so it's called TNF-alpha. And the protein was initially discovered in cancer cell line. That's why it's named with the tumor necrosis factor. Basically, it is inflammatory biomarkers, and it's increased in patients with cancer, with COVID, and with various health conditions. Is most of the almost all the inflammatory cytokines
mm,
are non-specific biomarkers for diseases or health conditions. It does tell if the level is high. It does tell us that something is not right. but it does not absolutely tell us where is the problem.
Mm.
Okay, and that the information is useful because something is going on. I can tell you, I mean, my TNF alpha level used to be very good. About a year ago, I got a COVID infection, and then my TNF alpha just went way too high.
Skyrocketed. Wow.
In the last year, I have been trying to bring it down. It has come down dramatically, but my level is still above the baseline that I had, higher than I would like to be. I think partly it was related to the COVID infection that took a long time, even though the symptoms were resolved pretty quickly. But the TNF alpha hangs around for a long time. And also it was a little bit related to the diet. I'm a Chinese, Chinese have to eat rice and a lot of carbohydrates. So my triglyceride was inching up a little bit. My TNF alpha was becoming high. So that's why I decided, well, I have to get rid of rice and a lot of carbohydrates. Since then, my TNF has been coming down. My
Oh,
triglyceride is totally normalized. My A1C has improved greatly.
oh,
Chinese on average have much higher A1C levels than Caucasians. And
interesting. I
yeah,
think
yeah,
it's
yeah.
so cool to see how different countries, like, I always want to go to Japan or something and do a heavy metal test because they eat so much fish. And I'm like, either you guys all have a ton of heavy metals or you're doing some green tea or something to detox all the heavy metals. I love how you can see all around the world certain things. It's very
Yeah,
eye-opening.
yeah, it's good because we have people from all over the world. People from the Middle East, they have a completely different biomarker profile.
So cool. So cool.
When you look at the different regions, different groups, and you get the information that you otherwise really cannot get.
I hope, this would be such a great thing to tell people if you're Asian or if you live in South Korea or if you live, in India, you really should check these certain biomarkers because you're more likely to have these biomarkers off that can, I think this should be a thing.
Yeah, yeah. So yeah, it was when you look at the different populations, you get the information that you don't get when you just test one particular population.
Area? Yeah.
Because when it differs from region to region or ethnic groups to ethnic groups, you get a very rich information that you otherwise don't have. I love to look at the data globally and figure out the underlying principles. That's what I think I'm good at. I enjoy it most.
I know. I think I'm like, maybe in Japan they have very high glutathione or something. Their detox pathways are amazing versus maybe in the US or maybe Caucasians or something don't have as great detox pathways. So
Yeah,
it's always so interesting to see, what's affecting who in different areas of the world. That's
yeah.
really cool that you have that insight. I'm jealous.
Well, then we have world data. I mean, we can talk about it. We can share with your audience, and as we go,
Yeah.
it's
Yeah,
absolutely my pleasure to do it.
this is so cool. I think so many people from around the world will benefit from this
Yeah,
podcast because then they can see we went over quite a few biomarkers, but you have 47 on your longevity panel, but we won't go over all of them.
yeah. We were adding another maybe a dozen or so biomarkers. While adding Alzheimer's panel.
Wow.
We're adding follistatin, and for those who are doing gene therapy. So we're adding quite a few. Galectin-3, that's important for Alzheimer's. And so we
Mm,
constantly add additional biomarkers, for the ones who are doctors, clinics, and, my message to them is if you want a particular biomarker, come to us. We'll work with you. We'll implement the SF for you if it's important, if you really want to use it. And that's what we are good at. So we can make easy decision, quick decision, and and having the scientific background allows me to judge what biomarkers are potentially important and what we should do it. So, and I can
yeah.
help people to design clinical studies to figure out what's good, what's not, And that's what I love to do.
Yeah. It's so amazing. It's so cool to see Jinfiniti growing nonstop. We're on a mission.
We're on a mission.
Yeah. I just want everyone to feel as good as I do now, and I just think a lot of people are not feeling good, and that affects the physical and the mental. So it's like once you realize, you know, when you start working on your physical health, that really affects your mental health and you start really feeling good mentally. And
Mhm.
that's the best part is feeling happy and no pain and energized. So, well, thank you so much. Everyone can go find you at jinfiniti.com and also download your PDF or your book is on Amazon.
Yes.
And you also have Instagram, Jinfiniti.
All my handles are at Prof. Jin.
Okay. Well, thank you. And everyone can go order your test to Jinfiniti.com. And so I've been promoting it because I love it just so much. I was truly amazed. So thank you again for coming on the podcast. It means so much. And I just had love this conversation. So thank you so much.
Thank you, Jenny. It has been absolutely my pleasure.